I'm Dr. Paula Amato, and I'm a reproductive endocrinologist practicing at Oregon Health and Science University in Portland, Oregon. I think more women are waiting longer to have children for a variety of reasons, and one of those reasons is that more women are pursuing higher education, and more women in the workforce and women are partnering later. Well, I think it's often challenging to plan when you're going to have children. I mean, you may have an idea of when that might be when you're younger, but circumstances may be such that they might not be optimal for you until you're older. And although there may be some disadvantages to later motherhood, there are also, I think, some advantages. I think women later in life are usually more well-established. Their financial position is often better, so that, in theory, there could be some advantages to having children later. I think there is some misinformation out there. I think there's very good data that fertility declines as women get older, and I think not all women are aware of that. And while it's true that technologies have improved to allow women to have children even when they're older, it's still one of our biggest challenges. So even with the most advanced reproductive technologies, there's still a decrease in pregnancy rate as women get older. So I think sometimes when in the media you might see celebrities having children in their 40s and sometimes 50s, what they don't always tell you is in some of those cases, those women have used donor egg, which is an option, but I don't think that women are always aware that that's what's going on, and it might give them false expectations about how easily or hard it might be to get pregnant when they're older. Certainly heartbreaking when I see a patient that didn't really realize that her fertility was declining as she was getting older. Women now have the opportunity to pursue education and workforce as well as motherhood, so that creates its own challenges. Certainly hard to do everything at once. What I see most often is that women can do it all, but sometimes they have to prioritize different things at different times in their lives. I think that freezing of unfertilized eggs is one of the great advances in the last decade in the fertility world. I think eventually it might become more commonplace. Unfortunately, right now it's still very expensive and not accessible to most women. But as the cost of that goes down, then I would imagine that it would be used more widely. I think the possibility of freezing eggs at a younger age does decrease the risk of miscarriage and certain chromosomal abnormalities, so it does have that advantage. Okay. Yes, I think it's regrettable that the assisted reproductive technologies are only available to a certain demographic of the population. I personally believe that medical insurance should cover fertility treatment. I think there's some data that some of the complementary and alternative therapies do improve fertility and increase pregnancy rates, namely some mind-body therapy and acupuncture. And I've personally been interested in both of those. I think in general, decreasing stress probably is helpful for dealing with any medical condition. So while the success rate with donor egg is much higher, for some patients, they would like to try with their own eggs first before they go that route. And oftentimes it's just for closure, but oftentimes it can be successful, even though the success rates in general are much, much lower. So while clinics are very protective of their success rates, I think patients should try and find a clinic whose philosophy matches theirs and will give them all the information and allow them to make that decision. That's why it's difficult sometimes to compare clinic success rates, because different clinics have philosophies when it comes to that issue. I think with any particularly elective medical procedure, when you do have options, I think it's important to look at the clinic success rates. It's often important to meet the clinicians and the staff and see how comfortable you feel. So experience, the patients I see have done quite a bit of research before they come to see me, actually. I think they definitely should be aware of the fact that fertility declines quite dramatically as women approach 40. So certainly they should be aware of that. It might be harder to get pregnant. The risk of miscarriage may be higher. The risk of having a child with chromosomal abnormality is higher. So all those things they should be aware of. The risk of complications in pregnancy is also higher in women who are older, so they should be aware of that fact. And if they require fertility treatment, often fertility treatments are associated with multiple pregnancy, and they should be aware of that possibility. But having said that, I think in my experience, most women in their early 40s do actually quite well once they're pregnant. One of the things that needs to change is there needs to be more education of women. I think women need to be more aware of the fact that their fertility decreases as they get older. I think also there needs to be improved access to fertility treatment. I think it should be more widely available than it is now. At the moment, it's very expensive and only available to the few. So I would like to see it more widely available. I don't feel like you or we are encouraging women to necessarily have children later, earlier. I mean, obviously, that decision is a very individual. But I think once a woman does find herself in a situation that she's either trying to get pregnant in her early 40s or having a child in her early 40s, then I think that woman is entitled to certain resources and support that aren't always readily available. I do think there is some bias against women who use assisted reproductive technology to conceive, and by definition that's going to include a larger group of older women. I think people, or some people, not all people, but are very quick to judge other people's reproductive decisions, and I've learned a long time ago not to do that. It's a very individual